And today I want to welcome our guest. We have Dr. Brenda Coughlin who is the President and CEO of the Great Lakes Bay Health Center. We have Firouz Saad, the Executive Director, Office of Global Michigan, representing Protect Michigan Commission. And also we have Dale Freeman from the Michigan Health and Human Resource of the state of Michigan in Lansing. So thank you, welcome to our guests. Thank you for being with us. And we also want to give some recognition to the organizations that are involved in putting this on, from the Mexican American Council to LEAD, to the Great Lakes Bay Hispanic Leadership Institute, the Unión Cívica Mexicana, the American GI Forum, Hispanic Ministries, and Mi Gente Magazine. Thank you all again for being with us. We don't have much time, so we're going to just move real quickly as we process through with our guests, as well as take any questions and answers that somebody who is watching the live may have. When you have a question, just type it in, and we have Leona Flores and John Ayala who are monitoring that, and will let us know what questions that you may want to ask. So we're going to first start with Firouz Saad. She has a presentation to help us to better understand about the COVID-19 vaccine.
Thank you so much. Yes, let me just share my screen here with everyone so everyone can see what I need you to see. Let me make sure, there we go. Oh, okay, here we go. And we're gonna go ahead and share this.
There we go.
All right. So once again, can you all see my screen?
Yes.
All right, wonderful. So once again, my name is Firouz Saad. I'm the Executive Director of the Office of Global Michigan. My office is within the Department of Labor and Economic Opportunity, and our primary focus is to work with immigrant, refugee, asylee, or international communities broadly on immigration integration programs and ensuring that our communities have access to the necessary resources that they need that are provided by the state. So that brings me here. As part of the Protect Michigan Commission, which was launched a couple weeks ago, 3 working groups were created within that commission. One of them a Latinx working group. The purpose of the working groups is to help implement the COVID-19 vaccination distribution strategy, which I'm going to go over as quickly as possible here, knowing that we're crunched for time. So the guiding principles, equity, inclusion, ensuring that our diverse communities have access to the vaccine. So doing everything we can to remove barriers, that the planning and distribution process is inclusive, that the communications is transparent and accessible, and that data is used to properly get the vaccine to the communities that need them the most as vaccinations become available. So our goals: 70% of Michiganders age 16 and up vaccinated as quickly as possible. 90% of the doses are used within the first 7 days. And then 95% of people get their second dose within the time frame that is expected. Zero disparity, that is our hope here, to make sure that all communities can access the vaccine equally and equitably. 20 minutes, the goal is that no one has to drive more than 20 minutes to get to a vaccine distribution center. So the CDC has kind of put some guidelines in place in terms of what some of the data protocols that we really should be following to help ensure that the vaccine is distributed, in an equitable and inclusive way. So you can see from here everything from socioeconomic status, household composition, minority status, language. Obviously, we want to make sure that our ESL, LEP, or English language learners have as much access to the information necessary to receive the vaccine, and then housing type and transportation. So based off of that, the allocation strategy will be kind of built on top of those guidelines for how we get to the communities, where those communities are, how many distribution centers are needed in the communities based off of the needs. So you can kind of see from here, you know, some goals within each of those standards. Social vulnerability index, you know, make sure again that regionally the distribution centers are allocated equitably based off the populace. So I apologize, I'm kind of running through this quickly, but obviously we can make sure this information gets to everyone as needed. And I'll stay on till the end to answer questions as well. So we'll be following census data to help guide us in the distribution and ensuring that we know where our communities are, who are where and what's needed. This will just kind of give you an idea of the map. I know maybe it's a little hard to read, but the overlay basically here, it overlays the social vulnerability index with the number of people vaccinated. You know, we get an idea of where we're at, what's still needed, where are the populations that still need them. So here is where we already have clinics that are providing vaccinations. As you can see, you know, Southeast Michigan has a greater bundle because that's where a populace are. And as you get into the more rural areas, you see less and less. Obviously, right now, we know that vaccines are not as plentiful as we would like them to be. The goal is that as more vaccines become available from the federal government, that we will have more vaccine distribution centers. So the goal is that this map will change and we'll have more dots. So right now, this is the schedule as it lays, and it really corresponds with our vulnerability of the communities, kind of who needs it, and then as well as the amount of vaccines we have. So obviously, if we had all the vaccines we needed, this wouldn't need to exist, and we could just be giving it out to folks as folks wanted them. That being said, currently, 1A is our healthcare workers and our long-term workers. Those are the ones that have been getting it since December. 1B, 75 years and older, frontline responders, school and childcare staff, corrections staff, and other essential frontline workers. 1C, 65 to 74 years old, 18 to 64 with pre-existing conditions, and then all remaining essential workers. Now, currently, right now, we're servicing the 1A to 1B populations. And I think the goal is 1C by April. But again, once vaccinations become more available, hopefully this timeline can change and things can start to kind of move on up. So strategy one, get more people vaccinated. It sounds pretty simple, but to a certain degree, it is that simple. It's why the categories exist, to make sure that we can get this vaccine shots in arms as quick as possible, starting with the most vulnerable in our communities. Strategy two, build a robust network of vaccination sites. The map that you saw earlier of where there already is distribution centers, like I said, we want there to be more dots on that map as more vaccinations become available and as people need them. The goal is that, you know, our Protect Michigan Commission that I mentioned earlier, you know, we're really going to be working as quickly and as closely as possible with our with those commissioners, with the working groups, to really help guide us through this strategy and knowing where the vaccine needs to go and how to get it there, community leaders and organizations that we can work with to make sure that also there's trust between the community and individuals who want it, and knowing where they're going is someplace they're comfortable going. So strategy 3, promote efficiency in vaccine delivery and administration. Obviously we want to streamline the process, make it as quick and easy as possible for everyone, everything from getting vaccines to the distribution centers to getting those vaccines in arms. Again, we'll be relying on those partners. We'll be relying on that robust network. We'll be relying on communications and getting the information to everyone to streamline this process and make this as efficient as possible. Strategy 4, mobilize personnel to maximize vaccination efforts. Some of you may have already seen this in your counties or in your local municipalities where they're asking people to volunteer to help at vaccine distribution sites. And in some places, they're even offering volunteers the vaccination at the end of the day. So these are just some of the strategies that are going to be implemented to help ensure we have the manpower needed to get people through those vaccination centers, to ensure that everything happens timely and efficiently, appointments are made and then seen through as people arrive. There's the Michigan Volunteer Registry that folks can go and sign up on to help if you're interested in helping in local efforts such as that. But obviously we'll be working with our frontline workers, we'll be working with our healthcare workers, the administrations, the infrastructure that's already in place. So just more of the same. So sorry, that was the end. So one thing I want to point out, and I know I'm just about at time, is that we're still looking for people to join our working groups. And so if you are interested, there's a number of working groups that folks can join. There's the Latinx, like I noted, but beyond that, there's one for rural communities. There's one for, I think, academia and college campuses and things like that. So there's a whole host of working groups, and I'm happy to share what that list is with the host today, and they can share it with you. And then there's an email you can reach out to if you're interested in joining any of the working groups. If you're interested in joining any of the ethnic working groups, which are Latinx, Asian Pacific American, and Middle Eastern, feel free to reach out to me directly and I'd be happy to connect you. My email is fsaadf@. And I think that's 10 minutes, so I'm going to stop.
Thank you so much, Fairuz, for that presentation. It's so important. And we as a community came together because we really feel it's important that we educate more about this COVID vaccine today, because as you have heard on the news media, there's a lot of information coming out. There's disparities amongst African Americans and Mexican and Hispanic populations, and we just need to push the idea and educate ourselves as well as our friends and family. And we have to make sure that we are part of the whole process of getting vaccinated. And sometimes in our community, there's not trust sometimes. And I think that that's one of the big hurdles that we need to get over. And so I want to throw this question out to Dr. Brenda Coughlin in regard to the vaccine itself. It's so important. Why should we get vaccinated? And what should we tell somebody who tells us, no, I'm not going to get vaccinated because I just don't trust it? What do we say to that, Dr. Coughlin?
Thank you, Larry, for letting me be part of working with you to collaborate and help our community to be safe. So I'd like to start by saying, just so everyone is starting in the same place, COVID-19 is short for coronavirus disease 19. They're this 2019. They're the same thing. They'll be used interchangeably. The reason that you should get vaccinated for coronavirus right now is that it is a very serious virus. In Saginaw County, 2 out of every 1,000 residents of the county have died from coronavirus, and only 8% of the people in Saginaw County have a documented infection. So if we all got sick, can you imagine how many people would die? The numbers would be astronomical. You need to get vaccinated for yourself to keep yourself safe. You need to get vaccinated for your family to keep your family members safe. If you have elderly relatives, you do not want to give them coronavirus. They are more likely to die from it than you are. If you have ill members of your family or your community, you want to just keep everyone safe. When people say that they're afraid to take the vaccine, they don't trust it, you really need to listen to the science and not the social media. There are a lot of false beliefs out there that you will see on social media about the vaccines that are available that are not true. The two vaccines available in the United States today, the Moderna and the Pfizer, are both 95% effective against coronavirus. That means your likelihood of getting it is 95% less than it would be if you didn't get vaccinated. You have to get 2 doses of the vaccine to get to that number. 1 dose only gives you about 50%, but 95% chance of not getting coronavirus, that is a huge percentage. And those are the, without that, so when they did the first tests on the vaccine, they tested 75,000 people. And of those 75,000, not a single one died from coronavirus. Without vaccine, you would have expected 150 to die just based on regular rates of people getting sick. So that is a huge difference. We're saving lives by getting the vaccine.
Dr. Coughlin, that brings me to the point of people may question and say, will the coronavirus, once I get it in my arm, can it give me COVID-19?
The vaccine cannot give you COVID-19. It does not have, none of the vaccines have a whole virus in them. So that what you get in your immunization cannot multiply in your body. It cannot give you coronavirus.
And for people who may not understand the actual process and they hear about having adverse reactions once they get that COVID-19 vaccine, can you tell me what actually is happening, say when they get a fever or when they feel that pain in their arm? Can you elaborate a little bit about that?
Absolutely, and that's a very important point, Larry. When you get your first vaccine, you may get some arm soreness and you may get some side effects. You may not feel much of anything. When you get your second vaccine, you may feel more. With the Pfizer, it's 21 days after the first one. With the Moderna, it's 28 days after the first one. And after you get your second vaccine, it takes 2 more weeks to build up all of your immunity. So your immunity isn't there the day you get it. But what you may feel is what happens is your body is given a little piece of the virus through the injection. And then your body figures out that it doesn't belong there and learns to fight it off. So if it ever gets exposed to the real virus, it can kill it. But as your body fights off that part of the virus that you're exposed to, you may get some symptoms like muscle aches. You may get some chills, mild chills. You may get some fever, usually a low fever, and you might get a headache. Most people get very mild symptoms. They last 24 to 48 hours. 2% of people may get a little more stronger symptoms. They may have more muscle aches, more chills. But what's happening is the pain and the discomfort that you go through is 24 to 48 hours versus a 2 in 1,000 chance of dying. The other thing, I've spoken with many people who've gotten the second vaccine lately, and all of us agree, if I feel this bad, which is mild aches and pains, if I feel achy for a couple of days now, what in the world would have felt like if I had gotten the real coronavirus? I have a friend who got coronavirus. He said he would rather have open heart surgery. Open heart surgery hurt less than getting sick with COVID.
Wow, that's a very big point there to point out. I want to also welcome to the show here Dal Freeman from the Michigan Health and Human Resources out of Lansing. Can you tell me, Mr. Freeman, what is going on in regard to, on a statewide level, the vaccinations that are sometimes set aside for individuals that are coming from our migrant population that we have to prepare for in the spring? And I know that that's something that you're involved with as well as Dr. Coughlin, but I think it's so important that we point out that you do not have to be a U.S. citizen in order to get the COVID-19 vaccine. Can you elaborate on that, please?
Yeah, that's correct. Thank you, Larry. Vaccines are being provided without regard to citizenship, without regard to immigration status, and they're provided without cost to the person who's getting the test. So it's free to you to get that vaccine. And it's important that everyone get the vaccine. And, you know, we have seen a lot of initiatives from within state government, but we've also seen the federal government really mobilize into this effort. And I wanted to draw attention to something that recently came out from the Department of Homeland Security on February 1st, showing that they are wanting to make sure that everyone in the country gets this vaccine and that they will not target any of the vaccination sites for any immigration action that they would be doing. And that's a really important piece. Everyone who needs a vaccination is going to get one, and they don't want to stand in the way of that.
Yes, yes. And I personally feel that our migrant population are essential workers. They're the ones putting the food on our tables, and I think it's so important that we take care of them, you know, as they come into our communities, make sure that they are vaccinated. Thank you for that input. I'm going to throw this question out to all of you, and you can answer whoever, but who should not get the vaccine medically?
If you have ever had anaphylactic or significant reaction to immunization, you should not get the vaccine. You should talk to your medical provider about it. But if you have previously had a significant vaccine reaction, you should not get that vaccine. Most people who have other allergies, not like food allergies, other kinds of allergies, can get the vaccine. But take the list of your allergies with you, or either talk to your medical provider or take the list of allergies with you when you go to get your vaccine and show it to them, and they will double check the list of ingredients of the vaccine just to make 100% sure that you will not have a problem with the vaccine. That also brings up an important point for you to know. When you go to get your shot, you get your shot and you are observed for 15 minutes afterwards to make sure that you don't have a problem. If you have had problems in the past or are considered high risk for a side effect from the vaccine, for an allergic reaction, they will observe you for 30 minutes just to make sure that you're okay.
Dr. Coughlin, what about pregnant women?
The recommendations are that pregnant women get vaccinated. Once again, this disease kills. And if you're pregnant and you get coronavirus, you can get very sick. So get the vaccine to protect you and your baby.
Today I heard coming from the White House, President Biden and his commission there, that they were in Arizona looking at a site that they were vaccinating 24/7, and they had gotten help from FEMA, and it was a very successful program where they were actually vaccinating 8,000 people per day. The variants that they're talking about variants all throughout the country, especially they're kind of more concerned with the UK variant that is causing havoc in the United Kingdom. Do we have to set up red flags and say, you know what, you've got to get this vaccine to stop the variants? Because that's what I'm hearing through the news organization. Can anybody talk about that?
There are 3 main variants that have become predominant in parts of the world right now. Coronavirus is a virus that mutates, and it mutates every 2 weeks. So it mutates all the time. And a mutation is just a simple change. It's like taking your name and changing one letter in your name. It changes a little bit, not a lot. The problem is sometimes some of those mutations are significant. There are 3, the UK variant, the Brazil variant, and the South Africa variant that are prominent right now in the world. The UK variant appears to be more transmissible than the variant that we started with. So what that means is it's easier to get. So get your vaccine, because the next version might be easier to catch than the previous version. And it appears that the vaccines that we're using today are very effective against the UK version variant from what I've seen so far. The South African variant, once again, seems to be more transmissible. It also, the vaccines may not work quite as well against it, but it appears that they probably prevent some of the serious disease. So they still work some, just not as well as they do against the other one. And that is early information. We're not 100% sure of that. And then the Brazil variant, I haven't found much data on yet, but our thought is similar. It's probably more transmissible, and the current immunizations probably give you some protection. We're not sure if it's as much protection now or not as much protection. We'll have to keep doing science to figure that out.
And so the White House is sending out a message, I believe, and correct me if I'm wrong, any of you, that we have to get this vaccination, at least 70 to 80% of the population in America, so that we can stop these variants from actually mutating. It sounds kind of like a science fiction movie, right? But this is where we are today, and this is really important. And I think that we have to make sure that we send this message out to our family and friends.
So if the virus mutates every 2 weeks, obviously gets more chances to mutate the more people it infects. So the fewer people that are infected, the fewer mutations we get. So get vaccinated so people quit getting sick, and we'll have fewer mutations to deal with. Does that make sense?
Yes, yes. And coming from the state of Michigan, from Lansing or from Detroit, is there any disparities that they're seeing in those communities? Kind of like we are feeling that we have disparities here with our people of color in Saginaw. Is that something that is on a statewide level that you may know of, or is it just misinformation that's coming out on social media?
Dale or Ferouz, would you like to speak to that, or would you like me to?
Happy to, if you want to go, and I'm happy to piggyback off.
So I'm sure many of you have seen in the national news, there is some disparity that's seen in the number of people who've been vaccinated, who have been in our, what we would consider Black or brown population. And some of that is because, so what's happening is that the state, the federal government, and our local health departments are spending a lot of time and effort to make sure that the vaccine becomes more available for people who have more barriers to getting it. So Great Lakes Bay Health Centers is a federally qualified health center here. The majority of our patients are low income, and many of them are minorities, or ethnic minorities or racial minorities. So the health departments, all of the health departments that we're working with in our counties, we are working together to figure out how to spread information to our patients so that they best understand how to get vaccinated and how to keep themselves safe, and to make sure that the vaccine becomes available in areas where people may have difficulties with transportation. They might have difficulties understanding what's going on. So there is a lot of work going on to make sure that the vaccine is available everywhere. The biggest barrier right now to everyone is that there is simply not enough vaccine. We don't have enough to give to everyone who wants it. But anyone who is eligible now, which is anyone 65 and over, you should sign up right now with your health department, because they're going through that list and vaccinating people. So if you know anyone who's 65 and over and they want that vaccine, get them on that list. You can go to their website and sign up today.
Thank you, Dr. Coughlin. And I'll just add to that and say that as you may have noticed in our presentation, it's obviously the goal of the state to ensure that we decrease and mitigate the amount of disparity in anyone getting it, and particularly communities of color and underserved communities that traditionally face barriers to accessing all sorts of things. And so, you know, we've learned a lot from the communities that were affected the most by COVID. You know, the governor, chaired by the lieutenant governor, introduced the COVID-19 Racial Disparities Task Force, which has really helped in gaining insight and information, and helped increase testing in those communities, you know, to mitigate the amount of infections and really lower those disparities as much as possible. So, I mean, the good news is that unlike when we were dealing with this a year ago and we didn't have any information and any data and didn't know what was going to happen or how it was going to happen, we've now had a year of information and learning. And obviously our hope is to build on top of that learning. And that is why, as you may have seen in the slides, you know, we're really gonna let the data drive as much as we can from the state, you know, and the vaccinations kind of come through the state and we further distribute into the local communities. But, you know, our goal is to really let the data drive where the vaccines go and how it gets to people. And again, that's why the commission and the working groups are going to be so essential. And I can't emphasize enough how important it is that if you have the time and, you know, the ability and the leadership within your community to help be that voice and be that advocate, we definitely could use you on the working group.
Well, I think that's part of the reason why most of the leadership from the Hispanic organizations have taken the step forward to actually get involved with this, because we have to make sure that our people are at the table, because it sometimes is difficult when there are, say, Spanish speaker only within our community. And that brings me to this question of what is being done on a statewide level for those that speak Spanish only in regard to getting that information out to them.
Larry, I didn't give you a partial answer there.
Oh, go ahead, Dale.
Yeah, so with regard to farm workers, as the Director of Migrant Affairs for Health and Human Services, we recognize that farm workers, and especially migrant farm workers, are an incredibly vulnerable population for a multitude of reasons. They have all of the barriers that the Latinx community has in general, as well as a lot of them that immigrant communities have, as well as because they are traveling from other states, they often don't know the resources in their community, and sometimes they don't even know what community they're in. So what we're doing is we're partnering with federally qualified health centers like Great Lakes Bay Health in your area to make sure that we are communicating. Our migrant program has staff that cover areas throughout the state, including this area, to make sure that farm workers are aware of the vaccine and are answering their questions, addressing some of the myths that they have, making sure they understand that it's free and that it's no problem for them to get it, and then getting them, helping them to get to Great Lakes Bay Health and get those vaccinations in place. So we're working to provide communications in Spanish within the department, but also I would say Leo is leading the way with Global Michigan providing Spanish translations and as well as translations in other languages of vital COVID-19 information. So to make sure that we're all aware of what's going on and how we can prevent this virus.
Yes.
Thanks, Dale. And I apologize, Larry, if I could just add to that. Yeah, as Dale mentioned, you know, the Office of Global Michigan at the onset of the pandemic, you know, we really advocated hard and worked with the governor's office and our partners within Leo to ensure that all COVID-19 relevant information was translated into 6 languages, actually, obviously Spanish being one of them. You know, we recognize how important language access is, and, you know, we're only as safe as our most vulnerable citizen during a pandemic. So, you know, we've kind of gotten into a system now. We regularly provide those translated documents to our partners through the commissions and otherwise. Hopefully many of them who are on this call and listening on Facebook are getting that. And if not, again, please reach out and we'll make sure you are added to our list. And, you know, we plan on continuing that obviously through the distribution of the vaccines and are working closely with MDHHS, who have said that they are committed to continuing to provide those translations. And even while we were limited to 6 languages during kind of the pandemic in terms of information, we're hoping that we can expand those languages on a need-be basis. So I know that we have unique communities with unique needs and native languages often that are used. And so, we're going to do our best to accommodate those communities as well. But again, if we don't know about them, we can't do it. So please, make sure that you're part of the commission and the working group as much as possible.
Yes, and that's so important. And I want to express that it's important that anybody who is, say, 65 and over, that they have an advocate, somebody who's going to pick up the phone for them and register them, whether it's with the Saginaw Health Department, whether it's with Myers, whether anywhere that there's a vaccine that's being distributed. Because with technology today, sometimes it's very difficult. I registered an aunt and uncle today, and it was very difficult in the process of getting that text information back and then responding on a timely basis. So I can imagine what somebody who may be 80 or 89 years old, they're not going to be able to do it. And I just speak from experience in regard to that. So please, everybody out there, make sure you're an advocate for your elderly. We have to make sure that our vulnerable population is being vaccinated, okay? So I also want to throw this question to Dr. Coughlin in regard to Great Lakes Bay Health Centers. Is the vaccine currently readily available, and is there a cost?
So currently the vaccine, as we've talked about a little bit, is very limited. It's not readily available. Everyone can't get it today. Right now, the state is only dispensing vaccine to health departments and hospitals. So Great Lakes Bay Health Centers does not have any vaccine today. Now, as we move forward, all of us have the hope that there will be more vaccine available as we go forward, and we'll be able to have some vaccine to provide directly in our communities. But as I said, we're working with the health departments locally, Lapeer, Saginaw Bay, Shiawassee, and Huron counties, and we're helping them to find locations to do immunizations close to our patients in the neighborhoods where people would have more challenges to get to vaccine. As Dale said, there is no cost of the vaccine to the people getting the vaccine. It is free. We do charge insurances, if you have one, for the cost of giving the vaccine. The vaccine itself is free. The United States government paid for it. The cost of giving the vaccine we charge to the insurance company, but no patient will be charged for that. There are mechanisms in place to pay for it. So no person getting the vaccine will be charged at all. If someone tells you that if you give them some money, they will get you a vaccine, it is probably a scam. I've seen some of those out there. So if they're saying you have to pay for the vaccine, don't do it. It's not real.
Thank you. What about our veteranos, our veterans? Can anybody tell us about them and the concern of getting them vaccinated as well?
The VA hospitals have been working through vaccinating the veterans. So if you are a veteran who receives services at a VA hospital, please contact them, because you will be able to get your vaccination there. And the VAs are also vaccinating the primary caregiver for the veteran. So if you're a veteran, check and register at the VA hospital, because they are getting vaccines also.
So in easier terms, basically, a spouse or a caretaker of a veteran can also get vaccinated at that time.
That is our understanding.
Wow, that's pretty good news for them. And it's important that we relay this information to our community, because I don't think that is something that is publicized too much out in the community. So thank you for that. Thank you for that information. At this time, I want to go to Leona Flores, because I believe that she is tracking and getting questions from our audience. Leona, do you have any questions at this time for the staff here?
Questions from the public that's on our Facebook here. This one person, I think this one is really important. It says, I've had shingles since November and still having nerve ending pain. Is it safe for me to get the vaccine?
I would talk to your primary care provider about that. It may be that your immune system in your body is so revved up with its current problem that I wouldn't add to that, but it's really a decision you should talk to your provider about.
Thank you. Our next question is, are there any mass vaccine sites going to open in Saginaw?
Saginaw has been receiving about, I think they're saying 3,000 vaccines a week right now. And those vaccines are being given in the order that Fairuz went through. So right now, the people being vaccinated are the teachers. They're almost all vaccinated now. And then we're vaccinating 65 and older. So we're not having vaccine sites where anyone can drive up to get a vaccine. You have to make an appointment and come in. So go sign up at the health department website. You can do it online. You can do it by calling the Commission on Aging at 989-797-6880, or you can call 211 and they'll help sign you up too. But there are mass vaccinations happening in Saginaw. Covenant is doing some, the health department is running some, Ascension St. Mary's are running some. Myers is starting to do some. You've heard about some of them. They've had some at SVSU. But the thing is, you have to be signed up ahead of time. You cannot drive up and get a vaccine. So get your names on the list. They'll call you when there's a vaccination site near you.
Great. Let's see. Any update on when people with chronic conditions can be vaccinated?
If you saw the timeline that Fairuz showed us, that timeline is showing that people between the ages of 16 and 64 who have risk factors would begin, we estimate, to be vaccinated April or May, probably May. Now, if we get a bigger vaccine, if we start getting more vaccine, we'll do that as quickly as we can. But at this point in time, we believe it's going to take that long until May to vaccinate everyone in the priority categories currently.
Another question. Where can we see the data on race and ethnic vaccinations?
I don't, I can look into that to see if that exists. I mean, I'm sure it exists somewhere. And so, you know, I would just have to kind of talk to my colleagues where and how and if it can be shared.
The only reason I think we're asking that is because we noticed that on the forms that everyone fills out to go get their vaccination, there's nothing on there about race or ethnicity. So I'm pretty sure that's why this question is being answered, because I think we feel that, you know, with the disparity of people of color, this really would have helped if those forms would have probably had that on those forms. And when we had our discussion this morning, they said, you're absolutely right. So just thought, you know, I think that's why that question is being asked. So
that's very helpful insight. I did not know that. And so so I'll certainly take it back to my colleagues.
Great. Were any migrants vaccinated last summer?
We didn't have any vaccine available last summer. It was only in trial phases. It wasn't available for us to immunize our migrant population. But I believe, and Dale probably has something to comment on, I believe the intention is this summer to attempt to vaccinate as many migrants as we can.
That is true. That is true. If the question came through, it may be that they're asking about testing. We were providing COVID testing for farm workers last summer, and that was something that agricultural workers throughout the state were getting those tests.
Great. Okay. And that brings up to a question. Another question that I received actually is, why did I have to pay for a test because I did not have insurance? So this has to do with a test.
You should not have had to pay for a test if you don't have insurance. The federal government has a program to pay for those. So I can't speak to the specifics. It might be that you received it at a site that wasn't billing to the federal government, but Great Lakes Bay Health Centers, we still test here at 501 Lapeer, and we never bill patients for tests.
It's probably one of these private facilities that are doing rapid testing, and they do require that. I can tell you, I know. So, can the vaccine be mixed to get the 2 shots?
The recommendation is not to mix it right now. I think actually in the UK, they're starting to do some testing to see if you get 1 shot, the first shot Pfizer and the second, or if you mix the shots, one is one and one is the other, how much immunity you get. But the 95% immunity that we know is available with the Pfizer and with the Moderna is by getting the same type. So if you get Pfizer first, you get Pfizer second. You don't mix the two. We don't know the answer to what happens if you mix them. The other thing I want to make really clear is if you get both shots and you wait 2 weeks, you should be in that 95% vaccinated category, but you still need to wear masks, wash your hands, and keep your distance because 5% are not immune because immunity wanes over time and it hasn't been long enough for us to really understand how long you're going to keep your immunity, and because there are variants that the vaccine may not work as well against. So don't quit doing things just because you've gotten the vaccine. It will protect you, but it is not 100%, and we want as many of you and our community members safe and healthy through this whole pandemic.
Yeah, and that's something that's really important. Excuse me, Leona, is that we do keep washing our hands, that we do keep that 6 feet distance. And what's the third thing?
Wear a mask.
Wear a mask. Everybody keep wearing that mask. Don't go somewhere where you see somebody not wearing a mask. The one question that comes to my mind right now, and then we'll continue with you, Leona, if you have more questions, is the fact, is it okay for us to get the flu shot right now if we're also getting the COVID-19 vaccine?
Oh, I did.
Good question, Larry. Thank you for bringing that up. You are not supposed to get another shot within 2 weeks of getting a COVID shot. So don't get a flu shot right now if you're getting a COVID shot in the next 2 weeks. If you've gotten a COVID shot, don't get your flu shot for 2 weeks. We're trying to give the body a chance to build up its immunity and not shorten that or lessen that because it's working on something else. So separate the shots right now.
Okay, Leona?
Great. I have one more question here, I think. I have friends who won't get the vaccine because they have heard it may change their DNA. How can I answer them?
I understand the concern. I've heard that concern. So the shots that we have are messenger RNA. They don't have DNA in them, and they do not intersperse with your DNA, so they cannot change your DNA. They don't go into the nucleus of the cell and mix with your DNA. So the shots we have, well, none of the shots do that. They don't change your DNA. I understand the fear. It's a natural fear, but they do not work that way.
Doctor, what I was saying was that in layman's terms, can we understand a little bit better about what is actually happening with the vaccine when it enters your body? You know, we talk about antibodies, antigens. People don't understand that terminology sometimes unless you've been in the medical field. And on my show, Mi Gente on Air, you talked a little bit about a cookie. Can you talk a little bit about that again so people can have an easier time understanding what's actually happening?
Absolutely, and I decided that I like a bicycle better.
Okay.
It sounds better than a cookie. So pretend coronavirus is a bicycle, right? It's got 2 tires, the seat, all the handlebars, all the pieces of a bicycle. What an immunization does is it shows you one piece. So for instance, instead of giving you the whole bike, it gives you a wheel. It's a bicycle wheel. If you see the bicycle wheel, you know what it came from, but you don't have the whole bicycle. So you're not going anywhere. So what the vaccine does is it puts a little bit of RNA into your system. Your cells see it and they take it up into the cell. They don't go into the nucleus to the DNA, it goes into the cell. And then your body makes some of that protein that looks like that wheel or whatever part, you know, they're working on spikes on the protein, but so they make the wheel. And then your body looks at it and says, that wheel isn't part of me, and it learns to kill that wheel. So next time, if you get exposed to the whole bicycle, your body says, oh, that's not me, and kills it right away. It doesn't even have to learn how to do it. It already learned it.
Oh, interesting.
Does that make sense?
Yeah. I would just like to ask the public, those individuals that are on today, I'd like to ask for volunteers to work with John Ayala and myself to register seniors. So I'll make sure, Monica, do we have a way, or do you want me to give phone numbers? You know, how do you want to do this?
They can actually leave it on either the Facebook page that we're on right now.
Oh, that's right, the discussion.
They can go to one of our Facebook page and leave a note.
Yeah, We'll be setting up, hopefully helping with some clinics and things, and we're going to need volunteers to help us register.
Yes, I think, as I stated before, we really need to be have advocates for our 65 and older population, but we also have to have advocates for the general population. And I think that's probably where the Hispanic Latino Regional COVID Task Force is going to come into play. So to the audience out there, I would say, if you've got a question or a concern, feel free to contact any of us that are on this COVID task force. And that's leaders from LEAD, as well as from the Unión Cívica Mexicana, from the American GI Forum, the Mexican American Council, or the Great Lakes Bay Leadership Institute. Because no question is dumb. Don't feel like you can't ask a question because it's so important.
Right.
This is something that we are in a battle with, and we are at war. We have to make sure that we are at the table as Latinos in the community, in the state, and that we are being listened to in regard to our concerns. So I want to thank everybody. I want to thank Fairuz and Dale and Dr. Coughlin for being with us today. I want to give you a wrap-up session right here. If any of you want to add anything to this Zoom Live conversation that we're having, please do so now. Anyone?
I will just remind everyone once again to please join a working group and help us be that advocate that you're talking about, Larry.
Yes, yes. Dale, anything from Lansing?
Just that I'm hopeful for more vaccine to be made available in the state, and that everyone who wants one can get one, and that people understand why it's important for them.
Yes. And Dr. Coughlin?
Thank you, Larry. Please consider getting vaccinated. This is how we're going to keep our community, our families, and ourselves safe. So consider the vaccine, and just be vigilant with all of the measures that we can take to prevent this disease from spreading. It is deathly, and we want everyone to remain safe and to be healthy. So consider how you can best keep yourself and your family healthy, and keep your ears open. If you are eligible for vaccine 65 and up, please register now, and you will get a turn, you will be called. And registering is how we get into that process, how you get into the row. But the rest of us, keep your ears open also, because there will be a day when it's your turn, and we need to continue to tell people, as you said, advocate, tell your friends, make sure the people in your church know when it is time for people to sign up, so that we can all get vaccinated in an orderly fashion as rapidly and safely as we can. Thank you.
Thank you. Thank you so much again, Dr. Brenda Coughlin, Dale Freeman, as well as Fairuz Syed. And I want to thank everybody on the Hispanic Latino Regional COVID Task Force for stepping up to the plate and getting involved, because it's so important. We have to be vigilant, and we have to go to battle, if you will. So thank you. Thank you again, everybody. And please stay safe. Good night.